All right, so today we're diving headfirst into emergency medicine.
Oh, yeah.
Specifically, we're focusing on gynecological emergencies,
Right.
those really urgent and complex cases
Yeah.
affecting women of childbearing age.
Yeah.
You sent over some case studies, and honestly, just skimming them, my pulse was racing.
Well, they really highlight the importance of a rapid and accurate diagnosis in these scenarios.
Yeah,
They can be very high stakes.
absolutely. We're going to be looking at two cases.
Okay.
The first one is a 27-year-old woman
Okay.
who's in a hotel room,
Right.
hit with severe abdominal pain, and then we'll move on to a train station in Manitoba.
Okay.
And this is another woman who is dealing with really intense lower abdominal pain, discharge, and chills.
Okay.
So let's jump right in. This first case, this one's a real nail biter.
Well, good.
Our patient is 27 in a hotel room, doubled over in pain. Her vitals show that she's conscious, strong radial pulse, but her skin is pale and clammy. She's also breathing shallowly, which I think is an immediate red flag.
Right. Shallow breathing can indicate a lot of things.
Right.
But in this context, could suggest the body is trying to compensate for something.
Exactly,
And-
yeah. The pain is sharp. It's localized in her lower right abdomen. And here's where things get really interesting. So she mentions having back pain for about 2 weeks and took some medication for it, but earlier today the pain became more generalized. Now it's localized and way more intense. And she also notes she had her period a few days ago.
I have to admit, my mind went straight to possible pregnancy complications.
No, it's a natural leap, especially when you consider her age and the localized pain.
Right.
But what's interesting here is that the source material really emphasizes
Yeah.
how crucial a thorough sexual history is
Yeah.
in these situations.
Yeah.
It even goes so far as to say that, missing this piece of the puzzle
Wow.
can be the difference between life and death. Wow, that's a powerful statement. Makes you realize how even seemingly unrelated details can be so important in these cases.
Absolutely. And, in this case, the combination of her age, the localized pain, her recent period, it all points to the need to rule out
Yeah.
pregnancy-related complications as quickly as possible.
Of course. And so the medical team jumps into action: oxygen, IV fluids, pain management, all the initial steps to stabilize her.
Right.
But then she becomes lethargic. She starts bleeding vaginally. Not good.
Definitely not.
Right.
Lethargy and vaginal bleeding.
Yeah.
In this context,
Yeah.
could indicate internal bleeding.
Yeah.
And the situation
Yeah.
has escalated quite dramatically.
All right. So I think it's time to address the elephant in the room, or, well, the fallopian tube, perhaps. The source material poses a key question. What are the predisposing factors for ectopic pregnancy?
Okay.
Could you break that down, why that's such a dangerous possibility?
Sure. So in a nutshell, an ectopic pregnancy happens when a fertilized egg implants outside the uterus,
Right.
most commonly in the fallopian tube.
Yeah.
The problem is, as the embryo grows, it can rupture the fallopian tube,
Wow.
causing massive internal bleeding. It's a life-threatening condition,
Yeah.
requiring immediate surgery.
So you have this ticking time bomb situation going on. I'm on the edge of my seat. They transport her to the hospital ASAP. But I have to ask, what makes diagnosing ectopic pregnancy so tricky? Because wouldn't an ultrasound confirm it right away?
You'd think so.
Yeah.
But it's not always that straightforward.
Okay.
Early on, an ectopic pregnancy might not be visible on an ultrasound,
Okay.
especially if the embryo is very small.
Okay.
Plus, the symptoms can mimic other conditions
Right.
like appendicitis
Right.
or a ruptured ovarian cyst.
So you're dealing with a lot of unknowns. It's like solving a medical puzzle with incredibly high stakes.
Yeah.
I imagine it's this dance between ruling out the most dangerous possibilities,
Yeah.
but also, managing the patient's pain and anxiety.
Absolutely. And this is where, a physician's experience
Right.
and judgment
Yeah.
really, really come into play.
Wow. Yeah. I can only imagine the pressure.
Yeah, they have to weigh
Yeah.
the risks and the benefits of different diagnostic tests and treatments, all while making sure that the patient feels heard and supported.
I can only imagine. So let's say you're the doctor in this scenario.
Okay.
You have this patient with excruciating pain, possible internal bleeding,
Yeah.
and the specter of ectopic pregnancy looming.
Right.
What kind of diagnostic tools would be most helpful at this stage?
Well, a pelvic exam would be essential.
Yeah.
but it wouldn't necessarily provide a definitive diagnosis
Okay.
of ectopic pregnancy.
Okay.
We'd also need blood tests
Right.
to check your HCG levels,
Right.
which is the hormone produced during pregnancy.
Okay.
And then transvaginal ultrasound
Yeah.
would be the gold standard for visualization.
Okay, so it's a multi-pronged approach, but what if the ultrasound is inconclusive or the HCG levels aren't clear-cut?
Right.
What happens then?
That's where things get really interesting.
Okay.
Sometimes we have to rely on what's called a diagnostic laparoscopy.
Okay.
It's a minimally invasive surgical procedure
Okay.
where a tiny camera is inserted through a small incision in the abdomen.
Yeah.
And it allows us to directly visualize the fallopian tubes
Okay.
and other pelvic organs.
So it's almost like a detective going undercover to get a closer look at the crime scene.
Exactly.
Yeah.
It's our way of getting definitive answers
Yeah.
when other diagnostic tools
Yeah.
have reached their limits.
Yeah. Wow. So much can happen behind the scenes in these situations, and to think this all started with a woman in a hotel room just trying to manage her pain. All right, so we've unpacked this first case, explored the complexities of ectopic pregnancy, and even touched on the ethical considerations involved in managing these emergencies. Now let's shift gears to our second case,
Okay.
which unfolds at a train station. We have another female patient,
Okay.
but this time she's battling lower abdominal pain, vaginal discharge, and chills.
Okay.
This case presents a very different set of challenges,
Yeah.
but it's just as urgent. I
Good.
mean, the location itself, I think, adds another layer of complexity.
Right.
Because the medical team might have limited resources
Right.
and equipment at their disposal.
Yeah, it's a whole different ballgame
Yeah, totally.
when you're not
Yeah.
in a hospital setting.
Right. So let's break down what we know about this patient. She's experiencing sharp pain, no radiation, started 2 days ago, and it's progressively gotten worse, especially with movement. She describes the pain as quite severe. But here's the kicker. She's been self-medicating with the birth control pills and penicillin.
That detail immediately
Yeah.
piques my interest.
Okay, why is that?
Self-medication, especially with antibiotics, can sometimes mask
Oh, okay.
or complicate the underlying issue.
Okay.
It's a reminder that we always need to get a complete picture of the patient's history, including any medications they've been taking.
Right, right. It's like trying to solve a puzzle when someone's rearranged some of the pieces. What I find really interesting is that she mentions the pain intensified right before the call for help. What's the significance of that, especially in the context of her other symptoms?
Well, that sudden intensification of pain,
Yeah.
coupled with the vaginal discharge and chills, could point towards an acute infection. And considering her age and the fact that she's self-medicating with penicillin,
Right.
one possibility that jumps to mind is pelvic inflammatory disease.
Okay. PID.
PID, okay.
Okay.
Now, for our listener who might not be familiar with this condition, can you explain what it is and what causes it?
Absolutely. PID is an infection
Okay,
of the female reproductive organs,
okay,
and typically it's caused by bacteria,
okay.
often the same bacteria that cause sexually transmitted infections,
Got it.
like chlamydia and gonorrhea.
Okay.
And it can lead to some pretty serious complications if left untreated.
Like what?
Yeah.
What kind of complications? Because I'm getting the sense this is more than just a, your run-of-the-mill infection.
You're right. It's not something to take lightly.
Okay.
PID can lead to chronic pelvic pain,
Oh, wow.
infertility, and even increase the risk of ectopic pregnancy. Wow, so the stakes are high here too. And this poor woman is at a train station trying to manage this pain on her own. I'm guessing the medical team didn't waste any time getting her to the hospital.
Absolutely not.
Yeah.
Given the potential severity of PID,
Yeah,
rapid transport and treatment are crucial.
okay.
In the meantime, they would have focused on stabilizing her vital signs,
Right.
providing pain relief, and gathering as much information as possible.
Right. So again, we see that importance of that initial assessment and intervention. It's all about buying time while they figure out the best course of action.
Exactly.
Now, the source material has a bunch of questions about PID.
Okay.
Things like, what are the typical signs and symptoms? And why is the knees to chest position beneficial during transport?
Okay.
I'm hoping you can shed some light on those.
Sure, sure. The classic signs and symptoms of PID include lower abdominal pain,
Okay.
fever, chills,
Yeah.
vaginal discharge,
Yeah.
and painful urination.
Okay.
Now, the knees to chest position might seem a bit odd,
Yeah.
but It actually serves a very practical purpose.
Okay.
It helps to relax the abdominal muscles and reduce pressure on the pelvic organs,
Makes sense.
which can be incredibly tender
Yeah.
and inflamed
Yeah.
with PID.
So it's not just about comfort, it's actually about minimizing the pain and potential complications.
It is.
I love that they even considered that detail.
It highlights the importance of considering
Yeah.
the patient's overall well-being
Yeah.
throughout the entire process,
Yeah.
from initial assessment
Right.
to transport
Yeah.
and treatment.
It's like a holistic approach
It is.
to emergency care. I love that. Okay, so we have these two very different cases here,
Yeah.
but I think they share a common thread.
Okay.
Sudden, severe abdominal pain in women.
Right.
And as we've seen, both situations have the potential to become very serious very quickly.
Exactly.
Yeah.
And that's why it's so important for us to understand these conditions, to be aware of the red flags,
Yeah.
and to know when to seek
Yes,
medical attention without delay.
absolutely. Knowledge is power. And I think this is a perfect segue into the next part of our deep dive, where we're going to delve deeper into the diagnostic process, explore those tricky questions from the source material, and unpack what makes these situations so unique and challenging.
I'm looking forward to it.
Me too.
Yeah.
These cases really highlight, I think, the incredible skill and dedication of those working in emergency medicine.
Yeah, they really do.
It's amazing. All right, stay tuned, folks. We're just getting started. Welcome back to the deep dive. We're really getting into the weeds here with these gynecological emergencies, exploring these situations where minutes can really make all the difference. You know, as we've been discussing these cases. One thing that keeps striking me
Yeah.
is the sheer amount of information the medical team has to process
Right.
in such a short amount of time.
It's true. It's true. These cases are like
Yeah.
fast-paced puzzles where
Yeah.
you're constantly gathering clues, trying to piece together the bigger picture. All while the clock is ticking.
Exactly. And to make things even more challenging,
Right.
the source material highlights that a lot of these conditions
Mm-hmm.
can mimic each other
Yeah.
in the early stages.
Right.
So you might have two patients presenting with very similar symptoms, but the underlying causes could be totally different.
Right.
How do they even begin to narrow it down?
Well, that's where the art and science of medicine
Yeah.
really come together.
Okay.
It starts with a thorough patient history, listening carefully to their description of the pain,
Right.
its location, intensity, duration, and any associated symptoms.
Right.
And then, of course, a physical exam is crucial,
Okay.
focusing on the abdomen and pelvic area.
Okay. That makes sense. But let's talk about some of those tricky questions from the source material. So in both cases, the medical team initiated those essential first steps.
Right.
Oxygen, IV fluids, pain management.
Right.
But then when it comes to the actual diagnosis, things get a bit more complex. In the first case, with the suspected ectopic pregnancy, we touched on ultrasound, blood tests, but what about PID? How do they confirm that diagnosis?
Well, with PID, a pelvic exam
Yeah.
can be very revealing.
Okay.
It allows the physician to assess for tenderness, masses, or any abnormal discharge.
Okay.
But to solidify the diagnosis, we often rely on laboratory tests.
Such as, give us the inside scoop.
Sure, sure. We typically order a complete blood count to look for signs of infection, like an elevated white blood cell count.
Okay.
We might also do a urinalysis to rule out a urinary tract infection,
Okay.
as those can sometimes present with similar symptoms.
Right.
So you're essentially trying to rule out
Yeah.
other possibilities while gathering evidence to support the PID diagnosis.
Yeah.
It's like building a case piece by piece.
Exactly. Yeah. It's like a medical whodunit.
It is. It is.
Now, in some cases, you might even perform a laparoscopy,
Right.
similar to what we discussed with the ectopic pregnancy.
Correct.
It allows you to directly visualize the fallopian tubes, ovaries, and surrounding tissues to look for signs of inflammation or infection.
Yes, and sometimes laparoscopy
Yeah.
can even be therapeutic.
Okay.
For example, if there's a pelvic abscess, which is a collection of pus,
Yeah.
the surgeon can drain it during the procedure.
Okay, so we have these diagnostic tools at our disposal, but the source material also raises a really interesting question about PID.
Okay.
It asks, why is the knees to chest position so beneficial during transport?
Okay.
We touched on this briefly before, but I'd love to kind of dive a little deeper into the reasoning behind it.
Sure. It might seem
Yeah.
like a small detail,
Yeah.
but patient positioning can actually make a big difference in these situations.
Hmm.
The knees to chest position helps to relax the abdominal muscles and decrease pressure on the pelvic organs, which can be incredibly tender and inflamed with PID.
So it's not just about comfort, it's actually about minimizing pain and potential complications. That's brilliant.
It is, and it highlights
Yeah.
the importance of considering the patient's overall well-being
Yeah.
throughout the entire process,
Yeah.
from initial assessment to transport and treatment.
Yeah, it's like a holistic approach. I love that. Okay, so we've delved into the diagnostic process, but now I want to shift gears a bit and talk about the psychological impact of these experiences,
Listen.
because I imagine it must be incredibly frightening to be in that much pain,
Right.
unsure of what's happening to your body.
Absolutely. These situations can be incredibly stressful and anxiety-provoking for patients.
Hmm.
They might be worried about their fertility,
Yeah.
the potential for surgery,
Yeah.
or even the possibility of a life-threatening condition.
Yeah.
And on top of that, they might be feeling embarrassed or ashamed, especially if their symptoms are related to their sexual health.
That's such an important point. We often talk about the physical aspects
Yeah.
of these emergencies,
Right.
but the emotional and psychological components are just as significant.
Absolutely. Yeah.
How can medical professionals address those concerns and provide support in such a high-pressure environment?
Well, first and foremost, it's about creating a safe
Yeah.
and non-judgmental space for the patient
Right.
to share their concerns.
Right.
Active listening,
Yeah.
clear communication,
Yeah.
and empathy
Yeah.
can go a long way in easing anxiety and building trust.
That makes sense. It's about treating the whole person, not just the symptoms. But I'm also curious about the role of patient advocacy in these situations.
Sure.
Because let's face it, when you're in excruciating pain,
Yeah.
it can be really hard to think clearly
Yeah.
and advocate for yourself.
You're absolutely right. And that's where friends, family members,
Yeah.
or even patient advocates
Right.
can play a vital role. They can help to ensure that the patient's voice is heard,
Yeah.
that their questions are answered, and that they feel supported throughout the process.
So it's a team effort with everyone working together to provide the best possible care.
It is.
Now, I want to circle back to something we mentioned earlier.
Okay.
The fact that many of these conditions can mimic each other
Right.
in those early stages.
Yeah.
This leads me to a question that's been swirling in my mind.
Okay.
What are some of the red flags that should prompt immediate medical attention, even if you're not sure what's going on?
That's a great question.
Yeah.
And I think it's important to emphasize that you should never hesitate to seek medical attention if you're experiencing severe abdominal pain,
Okay.
especially if it's accompanied by other symptoms like fever, chills, vaginal bleeding, or a change in your vaginal discharge.
So it's better to err on the side of caution.
It is.
Yeah. Yeah.
It's always better to be safe than sorry.
I love that advice.
Yeah.
And, as we've been discussing these cases,
Mm-hmm.
I've been thinking a lot about the importance of self-awareness and knowing your own body.
Right.
Because sometimes those subtle changes or nagging symptoms
Right.
can be early warning signs
Yes.
that something's not quite right.
Absolutely. Paying attention to those signals
Yeah.
and being proactive about your health
Yeah.
can make a world of difference.
Totally.
And it's especially important for women to be aware of the potential risks and complications
Yes.
associated with the gynecological conditions.
I couldn't agree more. Okay, so we've covered a lot of ground
We have.
in this deep dive.
Yes.
We've explored these two incredibly complex cases, delved into the diagnostic process, and even touched on the psychological and emotional aspects of these emergencies. But before we wrap up, I just want to take a moment to acknowledge the incredible skill and dedication of the medical professionals who handle these situations every day.
I couldn't agree more.
Yeah.
They're true heroes,
Yeah.
working tirelessly behind the scenes to save lives and alleviate suffering.
It's so inspiring to see their expertise, their compassion, and their unwavering commitment to patient care. Now, I know we've thrown a lot of information at you, so let's just take a moment to distill some key takeaways. What are the most important things our listeners should remember from this deep dive?
Well, I think the biggest takeaway is the importance of recognizing
Yeah.
The potential severity of gynecological emergencies,
Right.
severe abdominal pain,
Yeah.
especially when accompanied by other concerning symptoms,
Yeah.
should never be ignored.
Absolutely. And we can't stress enough the importance of seeking medical attention promptly, even if you're unsure of what's happening. It's
Yeah.
always better to err on the side of caution.
Absolutely.
Yeah.
Another key takeaway, I think, is the power of communication. Being open and honest with your healthcare provider about your symptoms, concerns, and any relevant medical history is crucial for accurate diagnosis and effective treatment.
Yes, and don't forget the importance of patient advocacy.
Yes.
If you or someone you know is experiencing a medical emergency, having someone there to advocate for your needs and ensure that your voice is heard can make a world of difference.
You've hit the nail on the head. Knowledge is power.
Yeah.
And feeling empowered to advocate for yourself
Right.
or for someone you care about
Yeah,
can be incredibly valuable in these situations.
exactly. Okay, we're coming up on the end of our time for this deep dive, but before we sign off, I want to leave our listener with a final thought. These cases have highlighted the incredible complexity of women's health and the importance of being proactive and informed. But they've also showcased the remarkable resilience of the human spirit and the power of medical expertise to make a real difference in people's lives.
Beautifully said.
Yeah.
And I think that's a perfect note to end on.
I don't know about you, but after going through those cases, I'm in awe of the medical professionals who deal with this stuff every day.
Yeah, it's really amazing. That combination of knowledge and quick thinking and compassion they have to have is really remarkable.
It's like they're medical detectives.
It is.
Piecing together these clues from the patient's history and their symptoms and the test results to try to arrive at the right diagnosis, and all under this immense pressure,
Right.
knowing that a patient's life could hang in the balance.
Exactly. And let's not forget the importance of communication.
Right.
They need to explain these complex medical concepts
Yeah.
to patients who are likely in pain and feeling anxious, and all making sure that the patient feels heard and understood.
Yeah, it's a delicate balance.
It is.
And speaking of communication, one thing that stood out to me from the source material was the emphasis on obtaining a thorough sexual history.
Right.
And I imagine that can be a delicate conversation to navigate, especially in an emergency setting.
Absolutely. It's a sensitive topic, and it requires a great deal of tact and empathy on the part of the medical professional, but it's essential information for accurate diagnosis and treatment, particularly in cases of suspected PID or ectopic pregnancy.
Right, because those conditions are often linked to sexually transmitted infections.
Right.
And so understanding the patient's sexual history can really help guide those treatment decisions.
Exactly. And it's important to remember that medical professionals are trained to approach these conversations with sensitivity and confidentiality.
Right.
Their goal is to gather the information they need to provide the best possible care
Yeah.
without making the patient feel judged or uncomfortable.
That's really reassuring to hear.
Yeah.
And I think it highlights the importance of building that trust between the patient and their healthcare provider.
Absolutely. Trust is the foundation
Yeah.
of any strong doctor-patient relationship.
Right.
And in these high-stakes situations, it's more important than ever.
So we've talked about the importance of seeking medical attention promptly when experiencing severe abdominal pain. But let's say you're not the one experiencing the symptoms. What if it's, a friend or a family member or even a stranger who's in distress?
Right.
What can we do to be good allies in those situations?
That's a great question. Sometimes just being present and offering support can make a world of difference.
Yeah.
Encourage them to seek medical attention, offer to accompany them to the hospital, help them communicate their symptoms to the medical team.
Yeah. Yeah. It's about being an advocate
It is.
for someone who might be, feeling overwhelmed or unable to advocate for themselves.
Exactly. And remember, even if you're not a medical professional,
Yeah.
you can still provide valuable support.
Right.
Listen attentively, offer comfort, and help them navigate the often confusing world of emergency medical care.
Those are great tips. And I think it speaks to this broader theme of community and supporting each other,
It does.
especially in times of need.
Absolutely.
Well, I think as we wrap up this deep dive into these gynecological emergencies, I'm left with a sense of awe, I think, for the resilience of the human body
Yeah.
and these incredible advancements in medical science that allow us to to diagnose and treat these really complex conditions.
I agree. I hope our listeners have gained a deeper understanding of these emergencies and the importance of seeking timely medical care
Yes.
and the power of being informed and empowered advocates for their own health
Yeah.
and the health of those around them.
I think that's a perfect way to sum it up. Remember, knowledge is power, and taking the time to learn about these important health issues can make a real difference in your life and the lives of those that you care about. Stay curious, stay informed, and stay well.